What causes emotional lability after a stroke and how can you cope? Imagine suddenly feeling overwhelmed by emotions that seem to come out of nowhere. That's what emotional lability after a stroke feels like. This condition, also called emotionalism or pseudobulbar affect, happens because of damage to specific parts of the brain that control how we express our feelings. When a stroke occurs, it can kill brain cells by cutting off blood supply, especially in areas like the brainstem and frontal lobes. These regions are essential for regulating emotions and their expression. When they're injured, the neural pathways that help us manage emotions get disrupted. As a result, people may experience involuntary, sudden bursts of crying or laughing that are out of proportion or inappropriate for the situation. It's important to understand that emotional lability is a neurological disorder, not just a psychological one, although it can lead to secondary issues like anxiety or social withdrawal. Signs of emotional lability include crying or laughing unexpectedly without a clear reason, feeling like emotions are more intense than what the situation warrants, and experiencing rapid mood swings that seem out of control. Sometimes, these emotional responses don't match what a person is actually feeling, which can be confusing and distressing. Coping with emotional lability involves several steps. First, getting an accurate diagnosis from a healthcare professional is crucial because these symptoms can sometimes be mistaken for depression or other mental health issues. Keeping a journal of when episodes happen, what triggers them, and how long they last can help your doctor understand your specific situation better. Medications can also help. Certain drugs, like antidepressants or those specifically approved for pseudobulbar affect, may reduce the severity and frequency of these emotional outbursts. These should always be used under medical supervision as part of a comprehensive stroke treatment plan. Psychological strategies can make a big difference too. Counseling or therapy can help patients and their families understand what's happening and develop coping skills. Techniques like mindfulness and breathing exercises can help manage emotional triggers and promote better emotional regulation. Education about emotional lability helps reduce feelings of embarrassment and encourages social engagement. Talking openly with family and friends about what you're experiencing fosters understanding and support. Joining stroke support groups can also be very helpful, as sharing experiences with others who understand what you're going through provides comfort and practical tips. Lifestyle adjustments are important as well. Participating in rehabilitation programs that address both physical and emotional recovery can improve overall well-being. Maintaining a regular routine, staying physically active, and engaging in social activities can help stabilize mood and reduce emotional outbursts. Remember, each person's experience with stroke and emotional changes is unique. It's essential to work closely with healthcare providers to develop a personalized plan that suits your needs. Managing emotional lability takes patience and support, but with the right strategies, many people find ways to cope effectively and regain control over their emotional health. Always consult your medical team for guidance tailored specifically to your condition.